Hello, I'm back with another short video about opioids and opioid overdoses. I'm Pete Mickelson. I'm the emergency doc here at Pullman Regional Hospital, medical director of the ED. Last time we talked a little bit about the epidemic, some of the numbers of overdose deaths both nationally and regionally. In this short video, I'm going to talk a little bit about how to recognize an overdose. What does it look like when someone's overdosed and what you can do about it. I think a lot of people may have seen some videos to the same effect of people overdosing. There was one very powerful photo that went around about two parents in the front seat in the passenger seat of a car with their 3-year-old in the back seat. They were basically unconscious. They had overdosed from opioids. What happens with opioids is what they do is they attach to certain centers in your brain, and those centers, those areas, are then depressed. They make you move more slowly, breathe more slowly, and then eventually not breathe at all. So in trying to reverse that effect, there's a medication called naloxone or Narcan. This medicine is basically an antidote to an opioid overdose. So you have someone who you think may have overdosed. How can you tell? They may be blue, they're not breathing. A lot of people talk about pinpoint pupils, although that's not universally true. A lot of times it's pinpoint pupils. They need to be woken up. Well, I want people to call 911 and activate the professional EMS folks. But in the meantime, there are some other things that can be done. In Pullman police are actually carrying naloxone, and they may be the first on the scene, and they may be able to reverse the effects of this medication. What they're doing is they're taking something like this. This is called an Atomizer, and what this does is you have the medication in here, and even if somebody's not breathing, you put it up to their nose, you can squirt the medication in one or both nostrils, and the medication can be delivered and basically reverse the effects of the narcotic, the heroin overdose or the pill overdose. Sometimes it can take several minutes to work, but it's what can save somebody's life. So as far as the opioid epidemic and what we can do, we can try to have better prescribe opioids for acute pain or more restricted chronic pain management. Families and friends can identify their friends and relatives who they feel are having trouble with opioids, maybe not using them for medical indications. We can have the Narcan or naloxone. Friends and families are able to carry this and maybe even save their lives if they need to. Continue to encourage anyone who's had trouble with those drugs, those opioids, to get help, seek professional help. Thanks for tuning in today for this short video. And the next video will be by Catherine Wilkins, who's an emergency nurse here at the hospital. And she'll talk a little bit about edibles, THC edibles, and the safety around those. Thank you.